I think it's interesting. The first chapter of your book is entitled Nothing Organically Wrong. And I had struggled for 2 to 3 years with energy issues. I went to my doctor, they did the typical blood workup, and they found nothing wrong with me. And the first chapter of your book talks about undiagnosed thyroid can mimic a lot of other problems, fatigue, weight gain. Could you talk a little bit about why doctors can't diagnose?
Well, you know, let's define our terms. Nothing organically wrong means you go into a doctor's office, you get a history and a physical examination, they do the routine battery of tests, and nothing shows up.
Mm-hmm. Exactly.
Despite the fact you have 3 pages worth, not you, I mean generically, that a person has 3 pages worth of complaints. And the doctor says that there's nothing wrong that I can find. It must be stress or it's all in your head. Now, basically, the tests that most doctors do are sensitive but not specific to many, many conditions, because by the time the tests start to go south and become abnormal, you already have severe deficiencies or imbalances in organ systems. Health is a continuum. Prior to an organ system breaking down, you can have nutritional changes, you can have physiologic changes which do not show up on these routine tests. In other words, we know that a person can have multiple nutritional imbalances, can have problems with digesting the nutrients, even if they're getting the nutrients, and lots of other things that don't show up. And as a result, a lot of people who are really clinically walking around basket cases are told that it's all in their head, go home and learn to live with it is another rubric that's used. And if a person keeps coming back and complaining, more often than not, particularly today, they're thrown on one of the psychotropic medications, i.e. an antidepressant or an anti-anxiety medication, which really does nothing but wallpaper over the symptoms. Since thyroid controls the metabolism of every cell in the body, you can have symptoms in any organ or tissue system in the body. It doesn't mean you're going to have symptoms on all of them, in all of them. I mean, it depends on your own genetic makeup, etc. But it can be anywhere. The most common complaint that I see is just chronic fatigue, that is not overcome by even 8 to 10 hours of sleep. People go to sleep tired and they wake up tired and they don't know what's going on. So the doctor invariably, if they suspect a thyroid condition, will do a couple of blood tests, i.e. most commonly the TSH. And if the TSH falls anywhere within this broad range of numerical, within normal limits numbers, they're told that it isn't their thyroid.
And the TSH stands for thyroid
stimulating hormone, which is a hormone that's put out by the pituitary gland at the base of the skull, which is a master gland that controls most of the endocrine organs in the body, most of the endocrine glands. In other words, it acts like a thermostat. So if your thyroid hormones are low, the TSH will go up. In other words, your thyroid stimulating hormone will go up because it's trying to push the thyroid to produce more hormone. Contrary-wise, if you have too much hormone, the thyroid needs less stimulation, so your TSH goes down. So your TSH actually goes in the opposite direction of your thyroid hormone. Your thyroid hormone goes up, your TSH goes down. Thyroid hormone goes down, your TSH goes up. And the normal range of TSH in most labs is about 0.3 to 5.5, just numerically. People don't have to know what these numbers mean, but 0.3 to 5.5. And if you're anywhere between 0.3 to 5.5, they'll tell you you're within normal limits. Well, that is completely wrong. About 2 or 3 years ago, from when we're doing the show, a group called the American College of Endocrinology, which is a traditional group of endocrinologists, came out publicly and stated that the upper level of TSH, which is used to diagnose hypothyroid, should be no higher than 3, which is a lot lower than 6, so a lot more people would be diagnosed. And in my practice, I've found that even 3 is too high. I treat people in the 2s and sometimes even in the 1s if they have thyroid symptoms, because if you put a person on a low dose of thyroid and they're symptomatic, there is absolutely no downside unless they have some pre-existing coronary condition, which I very, very rarely see. And most people do very, very well on it.